Good morning, everyone. So my name is Teanya Norwood. On behalf of Promedica Health Systems, I'm delighted to be here to share with you some of the highlights of strategies that we are employing in our acute care setting to address social determinants of health. So Promedica Health System, where our mission is to improve your health and well-being, is a mission-driven, community-based, not-for-profit organization that serves community in over 28 states. We serve more than 4.7 million patients each year at our 13 hospitals, 4 ambulatory surgery centers, and more than 400 post-acute facilities. And SDOH has been embedded in our strategic plan. In collaboration with educational institutions locally and regionally, Promedica offers research, grants, residency programs, nursing clinical experience, allied health, and continuing education. This is the wrong slide. Okay, we're going to roll through it. Okay. That's what nurses do, right? We adjust and adapt and keep on going. From our community health assessment need, which is a formal assessment that helps us adjust our programs and services to align with the needs of our community, we identified food insecurity. Now, food insecurity has been defined as limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. This led our journey to begin. As I said, with our community health assessments needs, you can follow around the map. Hunger became a health issue, and our organization knew that we had to do something about it. We have a brilliant, transformational CEO, Randy Ostra, who's a pillar of social determinants of health. We have our president of social determinants of health, Kate Summerfield, and director, Kendra Smith, who've done a lot of work around this. And we believe that treating the patient holistically by adjusting clinical, community, and research, embedding that into our practice is what's going to help us to move the needle. So traditional healthcare approaches, the patient shows up, he or she is late, right? The doctor is maybe a little upset because they have other obligations and patients to attend to, and the patient is nervous and they're trying to give them directions on what to do. Yeah, the patient may take the medicine and go home, but often we see that this alone is not enough. We don't always ask the right questions. We ask about and encourage exercise, but are we asking about safety in neighborhoods? We ask and encourage people to lose weight, but are we asking about their diet and ability to secure healthy foods? We want to know about a child's growth and developmental potential, but are we looking for signs of toxic stress? We provide education to patients. Do we know if they can even read? We criticize patients who fail to show up for appointments. Have we addressed any transportation barriers? And what drives health? We've heard it today. Only 20% of health is accounted for clinically. So when we look at the root cause analysis of health, we know that if 80% of our health is related to socio and economic factors, the physical environment, and health behaviors, that should drive us to make the change to address it if we really want to treat root cause of poor health outcomes. So we must go beyond our clinical walls. So addressing social determinants of health in acute care setting, we know that nurses, we make up a large percentage of the healthcare population with more than 3.9 million of dynamic nurse leaders. We are in the front line of changing this healthcare arena in all settings. The acute care navigation approach utilizes and aligns with Naylor's transitional care model. We are challenging the discharge process and planning and shifting to a transitional care planning approach. The key values of this approach include patients transition between care settings, but discharge planning can start, as we know, before admission and is continuous even after discharge from the brick and mortar hospital setting. Caregivers in all settings feel responsible for the care provided across the continuum and our integrated care system. This model also includes patient activation and engagement. Patient activation and engagement is the establishment of patient-centered care. It also includes the plans and helps us with risk mitigation, which is key. The patients need to be at the center of this. We take a holistic, person-centered approach with a focus on value and self-management. Care is comprehensive. It is not in silo. Through our integrated care navigation model, we engage with the at-risk population through primary prevention, in the acute phase, and in the post-acute phase. Care is coordinated. So we know that we must look beyond the walls of our organizations and look more into the community. At what place is a patient at risk for poor self-management or health outcomes? We can have a medically high patient who is well connected to care and resources and has a support system versus a relatively low complexity patient with poor social determinants of health. Who do you think is at greater risk for adverse outcomes? I'll say that again. A medically high-risk patient who is well connected to care, resources, a support system, versus a relatively low complexity patient with poor social determinants of health. Who is at risk for more adverse outcomes? 100. So in the acute care setting, we also work in tandem with social workers to execute the transitional care planning approach. It's okay. This is a nurse-led approach. Let me go back, sorry. This is a nurse-led approach, and each discipline works to the top of their licensure. Assessment of risks include polypharmacy, health literacy, care utilization, social support, access to resources and care, and other barriers to self-management. We also utilize a predictive analytics tool that is embedded in EPIC. It's our readmission score, which is a real-time risk score based on 27 triggers during hospitalization, including lab tests, high-risk meds, et cetera. Additionally, risk mitigation prior to discharge is key, and handoff to the next level of care is done by our care nurse navigators. Some of the SDOH, social determinants of health interventions and outcomes, have been food as medicine, food at discharge and at food clinics, depression screenings. We have a financial opportunity center, Pathways Hub, where we have community care workers who actually are able to help fulfill those needs for housing insecurities and provide housing prescriptions. And then we create linkage to community and social resources. What has been the advantage of us addressing, what has been the advantage of Promedica addressing social determinants of health? What have we seen? We've seen a reduction in ED usage, a reduction in admission rates, increase in primary care visits, and reduced PMPM. Implications for nursing practice. The transitional care management really embeds in the nursing practice to engage with the patients, to develop motivational interviewing skills to help the patient lead towards healthy behaviors. We also need to develop more competencies into the art of nursing realm. How do we get better with motivational interviewing? How do we better connect with our patients? Even though we may not have the same lived experiences, are we able to connect with them? We must promote patient activation and engagement, work to the top of our licensure practice. What does that mean? So it's interesting that when we had patients who screened positive for behavioral health, initially the nurses would contact social work right away, which is great. But we realized that we are trained, we are knowledgeable of implementing psychosocial interventions to address depressions and other areas of concern in relation to behavioral health. We must shift from a transactional to a transformational leadership style. Our all-in approach, the challenges that we see, the U.S. spends more per person on healthcare than any nation with comparable incomes. More people die of preventable diseases in the U.S. than in any other developed nation. The U.S. has a significantly lower life expectancy than other countries that spend less on healthcare. Our strategy, as a national SDOH institute, we focus on treating the whole person. We want to screen and connect to care and hope to reduce costs. We're also aiming to be that triple aim, to just not only just improve patient outcomes, but reduce costs and improve the patient's overall experience. We have to start somewhere. Thank you.